Want to unlock the secrets to a thriving business in the healthcare space and pick up some health hacks along the way? Health Hacks is the podcast that uncovers the latest and cutting-edge health secrets and inspiring business success stories. Each episode, we'll dive into innovative remedies, expert insights, and business hacks to take your practice to the next level. Now here's your host, Mark White.
Welcome to Health Hacks with Mark L. White. Today on the show, I'm very honored to have Dr. Kendrick Heywood. I've known you, doctor, for now, 10 years, 11 years?
Absolutely.
And I've always admired you. You've worked with me. You're from here. You're from Miami. Mm-hmm. You went up to University of Florida, came back to Miami. But tell me, how did you become such a leader when it comes to regenerative medicine, when it comes to hormone replacement therapy?
Well, I think that, you made me think of something, because I remember you gave me this book right when we left, right when you sold Health Gains, and it was called Game Changers, Innovators and Mavericks. And one thing you taught me, I didn't know about myself, I never thought I was a maverick. So I was big on outside thinking and looking at problems, right? So when I got into the industry, I thought, especially with Regen, that there was a whole space that could be explored and definitely optimized, and also with hormones too. Because I remember 10 years ago when I first started, it was just testosterone, omnitrope, and HCG. That was it. It was just nothing else. Now we got this whole wide range of peptides and everything else. But I think with this, we should start with the origin story. Like, how did I get into, functional medicine, anti-aging medicine?
Yeah, that's so you came down here. Mm-hmm. You were working as an internist?
Yes.
Okay, so how did you go from internist into HRT?
So I remember I met a friend of mine in Miami. He was telling me about this industry down in Brickell about anti-aging. So I went online and applied for a job in Jupiter. It was a huge company, you know them, Andrologics, and I had an interview. But I was just blown away about this concept about patients coming in, cash for fee, flying in, choosing their doctors, and finding doctors that they're paying cash for to get health in healthcare, and not just any kind of healthcare that was more preventative, because they called themselves at the time a preventive medicine practice. I was in the hospitals, working ICUs, long nights, 24-hour shifts, giving out statins, metformins, Cinepril. But I also wanted to get into something that showed me how can I reverse or treat the root cause of disease.
So how much of this stuff did you learn at University of Florida Medical School?
0%.
Why?
Because they are into the traditional medicine model, which is more, I treat the symptoms, my thumb hurts, treat me with an opioid or gabapentin or some kind of medication.
So you're down here, you're mm-hmm. working as an internist, and then all of a sudden you interview up in Jupiter with Andrologics, and your mind is blown, it sounds like.
Absolutely.
Okay, and then, so what did you do next?
So I started applying for more jobs, and I got my first job offer in Miami near Brickell, and I was working with a guy, named Klaus, and I started working at my first job into anti-aging. And that was amazing. That was my basic foundation I first started with.
Okay, and so the thought process then is people whose hormones are quote unquote normal, you're going to get them to the top end of the range.
Absolutely.
And back in those days, that was being a maverick in a lot of words, because mm-hmm. Doctors weren't traditionally doing that.
No.
You think you were doing anything crazy back then?
Well, back then, I didn't think I was doing anything crazy. I was just thinking, where have I been? And, where has the industry been? Because I just saw this article, because I work with this other company, and the FDA finally removed the black box warning from testosterone, right? About stroke and heart attack risk. So this was this huge thing that was going on. But in the industry, we both knew that was at a higher risk factor. That was kind of over-exaggerated.
Okay, so you start putting these guys on testosterone, you're putting them on mm-hmm. hormones, peptides. What kind of results are you seeing?
Oh, amazing results. and I was seeing patients, lose a lot of the abdominal or visceral fat, right? That kind of fat that can be, metabolically active, that causes high blood pressure, can cause you to have high blood sugar, diabetes, and high cholesterol lipids.
What I still want to understand this, it gets back to like the bigger picture is like you're at University of Florida studying medicine. Why aren't they teaching you this stuff?
I just think it's just, a piece of kind of ignorance, like they don't know about it. And they don't have a clue about like how useful this industry really is. I think they're waking up more to it now because of what's been going on with the obesity crisis, what I call the real pandemic in this country. But they're starting to open their eyes up about how important and useful this industry really is.
So they don't really, they're not really coaching you, or they're not really teaching you to coach your patients on lose weight and eat healthy.
No, absolutely not.
And so you're down here, you're putting people on hormones, they're losing weight, they're gaining muscle. What next?
Okay. And I really like that you said that because, we look at the 5 pillars of health. What you eat, so your diet, how you exercise, and how you supplement, right? But what's the 4th pillar? And one of that's going to be what I call, hormone optimization, right? So how can we get you to improve? So let's say you're in the gym working out for 4 months, you don't see any results, which happens. People understand you just can't go out and say, hey, I want to work out and change my life. What if your hormone's not optimized? You're not going to be able to be the efficient person you can. Let's say you're operating at 60%. How can we get to operate at 99 to 100% of yourself? And that's why I think hormone optimization is so important, because we want to help you get to the goal you're looking for.
Okay, so what was the 5th pillar?
So the 5th pillar, okay, we'll have to tap into that one. And you're familiar with this one too. So I look at the 5th pillar like red light beds, ozone therapy. Also, I look into IV vitamins as well. But I look at that as the 5th pillar of health.
So like the biohacking tools.
Absolutely.
Okay, so the first one is diet. In 2 sentences, how should we all eat? Because we all get conflicted information.
Absolutely. I think it's conflicted because I think we just had too many fad diets. Like Oprah came on and said that, and that we had so many fad diets. Absolutely, we had pescatarian, carnivore, keto.
Like different religions.
Oh yes, different sects. It is so divided. It's become a really like religion or like a cult. Like when people, you should only eat vegan. You can't eat cheese. Yes, absolutely. I think you eat based on one thing: your genes.
So would you say let's do a test, look at your genes, and then I can tell you exactly what you should be eating?
Absolutely.
Okay.
Because my problem with keto, everyone cannot eat keto. Some people have genes that, like ApoE heterozygous, their body's not able to process cholesterol properly. So they'll build up LDLs of 200 and 300 on keto.
Okay, so what kind of test, if I wanted to know what's the right diet for me, what kind of test should I do?
Well, you should do a blood, usually it's going to be a mouth swab, usually for the gene test. And I know Sarah Lomas with, 10X, they have a good one. And that's going to look into see what foods you're able to eat based on your genes.
Okay, then the second pillar was exercise?
Yes, absolutely.
Okay, should I go running? Should I lift weights? What do I do?
That's another one that I think they're covering too. So you should really exercise also based on your genes. But also another one I look into is based on your goals. Do you want a runner's body? Are you trying to build on like a lot of muscle, get like a much more lean muscular physique? That's also subjective too, but it should be gene based, some of it. But it should also be looked into based on like what goals you're looking to and what kind of body type you're looking for.
Okay, do you think so as we age, I've been reading that we should shift more away from aerobic exercises and more to muscle building?
Absolutely. Like I saw this article that saying that, people with the highest, like the 2.5%, bracket, in the nation or around the world, they have a 500 time more likelihood to have better mortality than someone who's have a very low muscle content. So, VO2, which is going to be aerobic capacity, how much oxygen you can take in, but also having a high muscle content could mean a longer life for you.
Okay, so it's First one is diet. Second is exercise. What was the third again? The third pillar?
Third pillar of health is how do you exercise?
How do you exercise? Well, that was the
And
exercise.
Then, right. And then the third pillar would be supplementation.
Okay, so what supplements, if I had to only take 5 supplements a day, what are the 5 supplements everybody, regardless of age, needs to be taking?
All right, so if for most people that can get supplements, you should look into one of my favorite ones, vitamin D3, B12, magnesium glycinate. Another of my favorite one is creatine, right? And if we don't have a sulfur allergy.
That's the bodybuilding.
Oh, yeah. But it's not just for the bodybuilding anymore. It's good for the mitochondrial function, like ATP production, and it's also good for the cognitive function now. And it's also the most studied supplement in the world.
Okay. So I'm eating right.
Mm-hmm.
I'm exercising the way you've told me to exercise. I've done my genes. I'm eating right, exercising. I'm supplementing.
Mm-hmm.
But if our hormones are not optimized, we'll never get results.
That's right. And I've seen people put a year in the gym, especially elderly gentlemen and females, put time in the gym, work out rigorously, and they're not getting the proper results.
Should everybody be on hormone optimization?
It's so tricky. I think majority of people can, but they have to be in the right health for certain hormones.
Are we taking shots? Are we taking gels? Are we taking pellets?
Well, it depends now. I think it's so many different modalities, but there's even oral testosterone that came out now that's FDA approved. I mean, you can do gels, creams, injections, pellets. All depends on what's best for the patients that they're going to be compliant with.
Now you mentioned peptides.
Mm-hmm.
What is a peptide?
So, simplest way to think about it is an amino acid chain. And they have different functions depending on the type of peptide. Some are good for cognitive, some are good for mood, some good for, putting on lean muscle, some good shaking fat, and some even help out with joints, ligaments. Such a broad range of peptides that can help you. But the best way to think about it is an amino acid chain.
Okay, so you're meeting with your patient. In the old days, what University of Florida would teach you is you meet with a guy and he says, I'm feeling okay, and there's not, I don't have an illness, you tell him to leave. That's what you have to tell you. Instead, you meet with these guys and they're saying, okay, I feel okay, but I don't feel my best. Now you're doing their genes.
Mm-hmm.
They're eating, you're finding out how they should eat.
Right.
You're putting them on proper exercise.
Right.
You're making sure they're supplementing right.
Right.
You're optimizing hormones.
Mm-hmm.
You're looking at peptides. Now, we've talked about peptides, but are you looking and saying, okay, what are your goals? And then saying, these are the peptides you should be on, or is there like a master peptide?
Well, I mean, you kind of hit it on the head. There's a few things. So, I still think the ultimate peptide would be, especially someone in their 50s, is optimizing IGF-1, right? Because that's going to be growth hormone, because they really need to try to put on as much lean muscle as you can. So to me, that's always going to be like one of the master ones, especially for anyone in their 50s. But peptides should be really be looked at based on the patient goal. And funny thing about med school, we wasn't taught that. What are your goals in life? Like, what are you looking for, right? So peptides should be generally like, okay, I have shoulder pain, I have arthritis, I'm 30 pounds overweight. Peptide program should be based solely on your patient's goals.
Okay, so if my goal is to not be in hip pain, my goal is to recover, what's the peptide I should be on?
Well, the one they have right now that I think is doing really well would be pentadecaarginate, and that's 99% similar to a previous peptide called BPC 157. And that's body protection compound, one of my favorite peptides to use. And didn't have many side effects, but I saw a lot of results, especially with arthritis, hip pain, and joint pain.
How about if you're looking to put on muscle now or lose weight?
Okay, that has me. So Mark, you bring me back. People don't understand that you were, we was like a health game together. 2020, we was one of the early adopters for GLPs. Like no one was doing them, right? Mm-hmm. There was not this huge countrywide meals, but we was June 2020 we started using GLPs. But we did not just use GLPs. We used GLPs with growth hormone peptides, everything. Mm-hmm. But we was big advocates of building lean muscle by using GHRP, testosterone, or amitrope to make sure you build good lean muscle, shake down visceral fat. But we also use that with small doses of GLP-1s to get our patients to lose weight. And we had great results with it.
Okay, so we're optimizing hormones, we're taking the right peptides, we're eating healthy, we're exercising, we're supplementing. And then the fifth pillar is all of these biohacks that you're seeing out there. What biohacks should people be doing that we're not doing?
They're not doing. So, I mean, you know, I remember the words when I met you. I was at you with the Biohacks conference. What's a biohack? Man, they actually said biohack can be burpees and glutathione, right? Seriously. A biohack could be anything that, you know, that's going to be like a hack in your health to get you the right results. I think some of the best biohacks out there that you can touch right now is definitely, you know, red light beds. I'm a big advocate from it. You know, infrared saunas, I do those all the time because, you know, get rid of toxins, things like that as well. And I do like IV vitamin therapies as well.
Okay, so red light beds, can't you just get red light from the sun?
You can, but you have to get it a certain time of day. So what time of day when the sun comes out looks red?
Morning?
That's right, first thing in the morning. So when you know, if we was all in, let's say, sub-Saharan Africa, what we do, the morning we rise, we'll get the red light from the sun, a little bit of UV, but the red light from the sun, and our feet would touch the ground, right?
So the grounding in the sun.
So we get grounding, sunlight, something that we've been doing for thousands of years. It's funny how it is because we live in a society, we got concrete, and we got high rises that we're not getting red light and grounding.
Okay, so infrared is giving you the light we need. Now, how does that translate into health for us?
So one thing we know about infrared light is special, that it does activate the mitochondria. Our mitochondria is the powerhouse of our cells. So we need NAD and oxygen for us to get NADH so we can get something called ATP, adenosine triphosphate, right? That's our body's energy currency, all of us around the world. But the problem is as cells get older and get sicker, they lower production of ATP.
So by keeping the mitochondria going, our ATP stays strong?
Absolutely.
Is there a way to measure that?
We had some testing that did look at it, but it's getting very difficult.
Okay. What other biohacks are popular besides red light?
I mean, so there's definitely other biohacks that are, you know, getting more popular. Another one that, you know, people start getting to was hyperbaric chambers. But again, you know, hyperbaric chambers was something that also kind of fights. I'm not saying kind of fights, but it kind of doing the same purpose, because one thing we do need to make ATP with is that we need oxygen, right? So now you're getting higher pressurized oxygen, like maybe over 2 atmospheres, to get you like more oxygen driven into the cell, right? So we can make more ATP.
So hyperbaric chambers and red light's giving us oxygen, and it's helping us produce mitochondria.
Yeah.
Okay.
Yeah, helping the mitochondria function better. So I think the ultimate protocol is hyperbaric chamber, right, with the red light bed, to really get that oxygen into those cells and get the cells able to produce ATP at its best. I call it the real superhuman protocol.
So when are you going back to UF to teach all those medical students all the stuff you know?
Man, that would be amazing.
So I'll tell you one thing I've seen is you've become an influencer. You've built your personal brand. You now work with a lot of athletes. Tell me about that journey.
Oh, that journey, you know, is definitely something that, you know, was 10 years in the making. I remember one of my patients told me, when are you going to be able to be your own influencer? And that's something that always resonated with me. But I think what started me was, I think like about 4 years ago, I was starting to get a little bit fed up with all the content out there, because I felt a lot of content I was making for patients wasn't right. So I would put out my content first to make sure that people out there getting the right kind of information. Like, what's out there you can do that's going to help you and move the needle? Because this industry's always been so tricky to get like the right healthcare, you know, advocacy, and then also get the right information to people so they can make positive changes.
What do you think is the biggest myth in the industry right now?
The biggest myth? Oh, man, that's a good one. So I think the biggest myth, what would that be? I can't even think, because you're right, there's so many myths out there. But
I don't know. I think like one of the myths I see is that anybody can just take hormones and it's like everybody thinks it's a magic bullet. That's one myth I see.
oh, you're absolutely right. You know, I think all hormones have their place, which you learned this because you're doing this like 10 years. You was in this industry doing this, but they want some of these hormones, testosterone too, and growth hormone to be the end all be all. I think now we start to see that a lot with semaglutide, tirzepatide. Like this hormone's going to make you lose weight, and you don't see that with all the patients because they have other reasons why the weight's not off, and it's not true.
I think the other myth out there is people think this stuff is easy. They don't realize like finding a doctor like yourself with all this, because what I've heard today is you don't learn this stuff in medical school, and you have to have a lot of experience. How many patients have you treated in your 10 years?
I treated thousands of patients, easy over 10,000, probably even more than that.
So all that experience is got to be huge. But tell me, like, what's one of the funniest cases you've seen, or something interesting that you've seen?
Oh man, I mean, where can we start? I mean, because we did so many great cases together that we can go to. You think anything right now?
I remember when Dennis Rodman was passed out, like when you were doing IV for Dennis.
Oh man,
he was sick, and you came up and you got him feeling good, and you saved his life.
Yeah, people don't realize like that moment was like, you know, he came into the office. I never forget this, and he was doing the marketing with you, right? And I met him, and we end up in my office, right? So I'm evaluating him. Everyone said, send him home, but I read his blood pressure and everything. I'm like, look, and I was in shock. I'm like, he's not going to make it. So people don't realize that when I met Dennis, I hugged him. I'm like, because he's talking about he wanted to go home. I'm like, you can't go home. You're not going to make it. So I'm in the other room getting ready. We're running IVs and medications, but I was in my office. No one knows this, but I had like a moment. So I like got in my office and I like hunched over. I'm like, oh my God, not on my watch. Like, we're going to lose Dennis Rodman. So when I had that moment, I'm like, not on my watch. So I like got together, got my bearings, went to the office, and people don't realize this is the middle of the pandemic, right?
I remember.
Yeah, I spent 4 hours with him because we had to get EMS, and the first one canceled, and then I had to get the fire rescue came in and brought him to the hospital. But people don't realize this. I got a call 8 o'clock at night. I'm on the phone with the ER doctor and the trauma surgeon, and his manager's calling me. They're trying to send him home, Dr. Heywood. Send him home. I just got home, and I talked to the doctor. I'm like, okay, this is Dennis Rodman. If something happens to him, you don't want that press. So right then and there, they sent him to the OR the next day, he had a long surgery, and then the next day after surgery, he came in, gave me a hug, and we were good ever since at Health Gains.
And you still talk with Dennis?
Absolutely.
Because I think that's the one thing that I see is very few doctors go above and beyond. You constantly, it's not just showing up, you constantly do what's right. And I think that plays so well in not just your reputation, but the clientele you've built. You now work with all kinds of athletes. What's next?
And I remember that day that happened. After that, you came and you told me something. You were like, so glad to have you on board, really.
Yeah. No, it's special. I mean, you're a special doctor. What's the future look like in terms of the industry, and what's next for you, Dr. Heywood?
Well, I mean, I think me and you, we had some home runs in this industry, that's for sure. And we was definitely the first proponents of exosomes, right? People don't understand that term was not even like out there. It was like 2020 June, and we was like the first ones to really put it out there, January 2020. I was reading an article saying that that's still gonna be one of the biggest things in the industry the next 20 years. Now what I'm seeing with exosomes, they're getting way more advanced. Now I think what's going on, I'm seeing new exosomes now, they're targeting. You get exosomes for skin, for hair, they're not just giving you a basic, they're differentiating these exosomes now.
So what, just for our people listening, what is an exosome?
Exosome, so that comes from a stem cell. It's secreted, so like a vesicle. So it's like think of it as a stem cell particle. But it's not just anything. That's the blueprints and the instructions for your body to heal itself.
Okay, so we're talking about like advanced form of regenerative therapy.
Absolutely.
And when we think of regenerative therapy, what are we talking about?
I mean, regen is huge. So one of the main ones that we all know is PRP. You heard stem cells. You heard of exosomes. You heard of growth particles. Those are what you kind of all looking to be regenerative medicine.
Yeah. So in regenerative medicine is getting your body to do the healing instead of like avoiding the surgery.
Absolutely. And the right candidates too. And you got to think about it like, we was all 8 years old riding on a bicycle and we fell and scraped our knee and got back up. Try that as a 40-year-old adult.
It's funny because like when you think of like the animal kingdom, animals when they hurt themselves, they don't go to the doctor.
No.
They don't operate. They don't take medicine. It heals on its own. So I think to me, like regenerative therapy is using science to heal on its own quickly. What do you see like with shockwave therapy, for example? How does that fit in?
Man, shockwave is a big piece of it because me and you, we did a lot of innovating with erectile dysfunction, but I think shockwave was amazing for that. And also just full body now, shoulders, any kind of knees, hips, all full body regen. But shockwave is a critical piece because I always like shockwave with it because I've seen with my patients better results. Because when you create those micro traumas in, the ligaments, bones, or even for erectile dysfunction, you trigger a response for the body to heal and repair itself.
So in terms of the athletes you work with, you see a lot of them now doing the stem cells, or doing like the gains wave for regenerative therapy.
Absolutely.
Recovery. What else is going to be really big that you see everybody, like your people talking about? What's the big buzz right now?
I think the big buzz right now, so right now I think we're in a great time, but I'm working with athletes right now. But I do think that as with AI is incorporating, we're looking into with the genes on how to properly optimize athletes, right? We're going to be able to do kind of personalized care that has never been done before in the last 100 years.
So it's really using AI to create precision medicine for your patients.
Absolutely. Even like new peptides now, like exercise mimetics, like we have exercise peptides to make you have even better cardiovascular health and to be able to push yourself at limits that you cannot do by yourself.
Great. So what is next for Dr. Heywood personally? Like what brings you the most joy over the next few years, or where do you want to be?
So, definitely I want to be at a better level of my influencing. So I definitely want to have more outreach and be able to reach more people around the world to give them the right, biohacking, anti-aging, ideas. And then also I want to still be, like you always told me, an industry leader. So be behind the cutting edge of the industry, make sure that people get the best health care possible. And one thing I would say about, we work so well together because you understood my vision. I was always big on outcome, right? We had numbers of days, but we had 5-star reviews on our office, right? Through and through, so many patients because I was always obsessed about the patient outcome. Even our page is still up, and you see it. Hundreds of 5-star reviews.
And at the end of the day, ultimately, when your patients get outcomes, amazing outcomes, some life-changing outcomes, they'll tell their friends.
That's right.
You'll build that following.
Yeah.
If somebody wants to get in touch with you, how do they do that?
That's pretty easy. You can go to my Instagram, Dr. Ken, Ken Heywood, Heywood.
And you've been really putting out a lot of Instagram, I guess reels, right? They call them reels.
Absolutely, reels. I still do some posts, but I do both.
You've become good at that. You're putting out a reel so they can follow you on Instagram.
Yes, and my content is very educational. If you go through the reels, you're definitely going to learn some things day by day.
That's amazing. I really appreciate the time. Thank you so much.
Same.
You've been listening to Health Hacks with your host, Mark White. Make sure you subscribe to Health Hacks wherever you get your podcasts. Health Hacks is brought to you by OmniWave, your gateway to regenerative therapy. The ultimate shockwave device on the market, delivering absolutely pain-free, non-invasive regenerative treatments. To learn more about OmniWave, head on over to omniwave.com. If you're interested in joining the OmniWave network, book a call with our experts, and for being one of our listeners, you're entitled to a special promotion by using this code, HACKS. Thanks for listening.